So I was wondering, like, what's like a good like long definition for epilepsy that like pretty much explains it, even like through all the different types.
Huh. Well, it's just when you mean like kind of down. Okay, so anytime somebody has epilepsy, that means that the brain waves in their brain they don't react the same as other people's. Maybe it's kind of like a storm. Mm-hmm. So when there's lightning on one side of the storm, then that causes the other side to misbehave. I don't know about like an exact definition.
Yeah.
But that's pretty much what it's kind of like a storm.
Okay. And then like I have temporal lobe epilepsy, but like what are like other types that there are? And
so
like,
there's focal epilepsy. So the different lobes, that just means so an EEG, which you've had those done, an EEG will tell us what your brain, like the waves are doing, what it's doing, and then an MRI tells us the function. So it shows a picture and then it shows us the activity. So you have temporal, and so that means that your activity occurs in your temporal lobe. So some people have focal, that means it occurs in their focal lobe. It just depends on where their epilepsy is, sometimes determines how we treat them.
Okay. And then like how does medicine vary, and like what are different types of like, I guess like side effects?
Gotcha.
From different
a lot of side effects we see are agitation with the Keppra, we get that. Drowsiness when they first start taking it, that's some stuff. We don't have a ton of side effects. We try to prescribe based on the patient. So some boys do better with certain medications, some girls do better with certain medications. So usually grouchiness is something that we get, agitation, just like getting used to the meds. That's usually what we see, and then there's a bunch of different meds we use based on what type of epilepsy you have. If you have focal, we're going to use something different than if you have, like your kind. Also, depending on where it's at, that will also tell us what medication we use.
Okay, and so like, whenever I have a seizure, like I don't need to be like rushed to the hospital or anything like that. Like obviously I have to like take note of it, but like what like different like in terms of like different types of like epilepsy, like what has to be done like when you have them and stuff?
So some of the like you don't have to be rushed to the emergency room. Do you have a diastat on hand? Nope, you don't have to have a diastat. So we have some kids that have to have an emergency medication called diastat. So if their seizure lasts longer than 5 minutes, then we administer that to them, and that helps stop their seizure. It just depends, there's some kids that have to have that, some that don't. It is rectal, so there's that, and then there are some that we can put like under the tongue. So if someone were to have like a grand mal seizure and they have convulsions and loss of consciousness, we're going to administer diastat, and they're more than likely going to go to the hospital. Depending on not all people who have epilepsy have convulsions, so not all of them shake. Some of them it's as simple as a head drop, and that is their seizure. So those are harder to identify than others. So it really just depends.
And like, how many like types of types of seizures have you like dealt with or seen?
We see quite a few here. Dr. Pena has been working as long as I've been alive, so he's seen a lot here. I've been here about 2.5 years, and I've seen quite a few. We see all, everybody's different. We've got kiddos like you that come in, all we got to do is just refill the meds, make sure you're doing great and your levels are awesome. And then we've got some that are, don't necessarily want to work with the medication, so we have to trial and, keep on trying different ones till we get the perfect one.
And like, I know you're not a surgeon, but like, if someone like has a seizure, like, and they need to have surgery, like maybe immediately or something like that, like how would you do that? Like,
so we do not have pediatric neurosurgery right now here at Centennial, but we do have it. They have it at Vandy. So we would just get them with a consult with them. Usually when we send patients, they have to have all their MRIs. And then usually the family goes in to discuss whether or not this surgery is going to help. So we have this side of the brain and this side. So epilepsy and the seizures are, can happen when the brain, because it's together. There are things where they will go through and do incisions and fix it, and the epilepsy is much better. It just depends, but they would probably go to Vandy for that.
And so, like, my last question is, like, how, like, do people, like, identify that they have epilepsy? Because, like, I know that a lot of people are just born with it, and, like, or like my brother, for instance, like he had one, and like obviously that's how they know. But like for me, like how would I have identified that I like had it or something like that? What are like some common
some people
signs?
go a long time without knowing that they have epilepsy. A lot of times it's parents more than the patient noticing that different behaviors, like let's say you're just talking to me right now and we're just staring, that could be an absent seizure, you know.
Mm-hmm.
So it's really just the parents picking up on everything. A lot of times, usually a larger one occurs for us to find out, unfortunately, and for us to get the EEG. But normally it's just, you know, it just happens.
Mm-hmm. Okay. Thank
Okay,
you.
you good, babe?
Yes,
Okay.
thank you.